Hey everyone, and welcome! Today we're going to talk about something really powerful, the healing power of touch, especially for older adults. We're diving into a specific therapy that, as you're about to find out, is so much more than just a way to relax.
Let's start with this quote from the American Medical Association because it really hits the nail on the head. It tells us that stress isn't just a feeling, It's a real physical force that puts an incredible amount of strain on our bodies. And as we get older, our ability to just bounce back from that constant pressure starts to fade, which makes its effects even more serious.
So, let's kick things off by digging into the why. Why is chronic stress such a huge problem for the aging body? What is it actually doing to our health day in and day out?
What you're looking at here is basically the body's fight-or-flight alarm system. And it's fantastic if you need to, run from an immediate, real danger. But the problem is, when the stressors of modern life, traffic, bills, worry, keep that alarm blaring all day long, it causes some serious wear and tear. It's like keeping a car engine constantly revving in the red zone. Sooner or later, things are going to start to break.
And this is what happens when that engine is always in the red. This constant state of high alert is directly connected to some of the most common health issues that older adults face. It's not just a coincidence, it's a clear cause and effect, a direct physiological chain reaction.
Okay, so we've got the problem pretty clearly laid out. Now let's turn to a really interesting solution, a type of therapy that's specifically designed to push back against all these effects.
Now, I want to be really clear about this. Geriatric massage is not just a regular massage, but, a little bit lighter. It is a completely different approach. It's a specialized form of care where therapists consider absolutely everything: skin that might be more fragile, chronic conditions like arthritis, even medications a person is taking, to create a therapy that's incredibly safe and deeply effective. In this chart, it lays out the difference perfectly. A standard massage might be all about digging into deep muscle knots, but with geriatric massage, the whole game changes. The priority shifts completely. We're talking about using light, gentle pressure to boost circulation, ease stiff joints, and provide comfort, all with techniques that are tailor-made for a more delicate body. The goals are just fundamentally different. All right, so what's the payoff? What does this super specialized approach actually do for people? Let's take a look at the real, tangible benefits for both the mind and the body.
Okay, check this out. This is a really powerful piece of research. A study found that for patients with severe dementia, a regular, gentle massage program over just 6 weeks was able to significantly cut down on their stress and agitation. Think about that. It just goes to show you the profound impact this can have, even on really complex conditions.
And what's so cool is that the benefits aren't just stuck in one little box. It's not just about the physical. We see incredible improvements across the board in physical health, emotional well-being, and even in creating a sense of social connection. It's really about treating the whole person. Okay, let's talk about the physical stuff first, because the list here is pretty amazing. Increasing blood flow is a huge one. That helps with everything. Then there's relief from chronic pain, softening tight muscles, and that last one, proprioception, that's just a fancy word for your body's sense of where it is in space. Improving that is absolutely crucial for preventing falls. And on the emotional side, the impact is just as massive. It directly fights back against all that stress we talked about earlier. It can help people sleep better, and the gentle touch actually stimulates the nervous system to release those feel-good chemicals like serotonin and dopamine, the body's own natural mood boosters. All of this just fosters this powerful sense of well-being.
Okay, but let's talk about the big question: safety. With any kind of therapy for older adults, safety has to be the #1 concern. So how do therapists make absolutely sure this experience is beneficial and not risky?
Let's just tackle this question head-on, because it's a completely fair thing to wonder. And the answer is a definite yes. But, and this is a big but, only when it's done by a trained, certified professional who truly understands all the unique considerations of an aging body. See, a professional therapist doesn't just jump in. There's a whole safety protocol, a checklist they go through. It all starts with a really thorough assessment of a person's health history, any chronic conditions, and especially any medications they're on, like blood thinners. It's only after that deep dive that they adapt everything: the pressure, the person's position, even how long the session is, to make sure it's 100% safe and comfortable for that individual. And this brings us to what might just be the most important part of all of this, something that goes way beyond muscles and circulation. I'm just going to let this quote sink in for a second. It's something we don't often talk about, But for so many older adults, especially if they've lost a partner, that simple, caring, positive human touch can just disappear from their lives. And that can lead to some really profound feelings of loneliness.
And that right there is why geriatric massage is so much more than a clinical treatment. It's a form of connection. It communicates care in a way that words just can't sometimes. It provides comfort, it battles loneliness, and it nurtures a person's spirit right alongside their body.
So I want to leave you with this question to think about. Our world is getting older. The need for compassionate, effective care like this is only going to get bigger. It makes you wonder, how can we make sure we're bringing more of this healing touch to the people who stand to benefit from it the most?